Hello, friends. Welcome to the second lecture of Let's Simplify Orthodontics for Dental Students. Today, we'll be talking about branches of orthodontics. Orthodontics is divided into branches based on the timing of orthodontic intervention and the complexity of the procedure. It is divided into four parts. One is preventive orthodontics, second is intersective orthodontics, third, corrective orthodontics, and fourth, surgical orthodontics. Now let's see each one in detail. Preventive orthodontics, as defined by Graeber, is the action taken to preserve the integrity of what appears to be normal occlusion at a specific time. Here it is important to understand the term normal. The concept of normal changes with time. Normal dentition at 6 years of age is not necessarily normal at 16. Hence, the terminology normal at a specific time or normal at that particular age is important. So, basically, preventive orthodontics are procedures undertaken prior to the onset of malocclusion so as to prevent development of the same. Now, what is included in preventive orthodontics? As suggested earlier, these are procedures undertaken prior to the onset of malocclusion. Here, the malocclusion is not set in. So, the procedures include patient and parent education. Here, we are talking about education of the patient and the parent regarding the importance of deciduous teeth, importance of regular dental visits of the child, importance of brushing techniques, use of the right toothbrush, fluoride content in the toothpaste, and frequency of brushing and use of adjunctive oral hygiene aids. Next is fluoride treatment. Fluoride treatment is undertaken in the deciduous and the mixed dentition so as to avoid dental caries. Early restoration of caries. Early restoration of caries is done so as to avoid extraction of deciduous teeth, provide adequate contact points between the teeth, and to maintain the arch length. Premature loss of deciduous teeth due to dental caries can lead to impacted permanent teeth, malposition of permanent teeth, crowding of teeth, loss of arch length, complication in the interarch relationships, compromised oral functions like speech and mastication. Pit and fissure sealants. Deep pits and fissures on occlusal surfaces of the teeth are susceptible areas on the teeth for the onset of dental caries. Pit and fissure sealants, especially on the permanent first molars, fill in the deep grooves, that is the pits and the fissures, where food and bacteria can get easily trapped and where teething is difficult. Pit and fissure sealants is an effective way to prevent dental caries in children. Space maintainers. Space maintainers are appliances given to maintain the space for the erupting permanent teeth after premature loss or extraction of deciduous teeth. There are different types of space maintainers like unilateral, bilateral, fixed, removable, which we will study in detail as the lecture series goes on. Unilateral fixed space maintainers can be in the form of band and loop, crown and loop, band and bar, crown and bar. Bilateral fixed space maintainers can be in the form of transpalatal arch, lingual arch, non-palatal button, etc. Removable bilateral space maintainers can be given in the form of removable partial dentures. Lastly, we come to early recognition and elimination of oral habits. Here we are talking about oral habits like tongue thrust, thumb sucking, mouth breathing, which might interfere with the normal development of the teeth and the jaws. Early recognition and taking steps for elimination of these oral habits is a very effective way to prevent malocclusion and thus preventing orthodontic treatment as a whole. Interceptive orthodontics. Interceptive orthodontics, as defined by the American Association of Orthodontists Council on Orthodontic Education, is that phase of the science and art of orthodontics employed to recognize and eliminate the potential irregularities and malpositions in the developing dentofacial complex. Here we need to understand the difference between preventive orthodontics and interceptive. Preventive, the malocclusion has not set in. They are the steps taken to prevent malocclusion and to prevent orthodontic treatment. In interceptive orthodontics, the malocclusion has already set in, but it has not reached its severity. So we are intercepting the malocclusion. So in simpler terms, here the dentition is not normal at this particular time. Malocclusion has begun to set in. They are the procedures taken at an early stage of malocclusion so as to eliminate or reduce the severity of the same. Appropriate interceptive procedures can prevent establishment of full-fledged malocclusion that may require long-term corrective orthodontic treatment at a later stage. The different procedures taken in interceptive orthodontics. The most important is serial extraction. Serial extraction is basically extraction of certain deciduous teeth and specific permanent teeth so as to reduce the complexity of malocclusion and to create space for eruption of the permanent teeth. Second is space regainers. The difference between space maintainers and space regainers is space maintainers are given to maintain the space. There is no loss of space by the shifting of the adjacent teeth. In space regainers, there is a certain amount of loss of space by the migration of the adjacent teeth. So here the appliances are given in cases where there is slight or moderate loss of space for erupting permanent teeth after premature extraction of deciduous teeth. 2x4 appliance in fixed orthodontics. A fixed orthodontic appliance involving 4 anterior teeth and 2 first molars is known as a 2x4 appliance. Functional appliances are given for growth modulation in interceptive early stages of malocclusion so as to prevent the severity of skeletal malocclusion. Habit breaking appliances can be to correct deleterious oral habits like tongue thrust, mouth breathing, thumb sucking, etc. Corrective orthodontics. As defined by Graeber, corrective orthodontics recognizes the existence of a malocclusion and the need for employing certain technical procedures so as to reduce or eliminate the problem and the attendant sequelae. In simpler terms, we know that the malocclusion is set in and it has reached its complete severity. The dentition is not normal at this particular time. So these are the orthodontic procedures which are included to correct a full-fledged malocclusion. These mostly involve certain technical procedures that attempt to reduce the severity of the malocclusion and help eradicate its cause. It's best handled by a specialist orthodontist. Mostly it includes fixed appliances, certain growth modifying appliances. Fixed appliances can be in the form of labial orthodontics, can be in the form of lingual orthodontics, or can be in the form of aligners. The last branch in this is called surgical orthodontics. Surgical orthodontics, as the name suggests, includes certain surgical procedures that are carried out before, during, or after active orthodontic treatment. Surgical orthodontics is basically undertaken with or in conjunction to orthodontic treatment. In simpler terms, surgical orthodontics usually involve procedures done so as to remove an etiological factor or treat the very severe dentofacial abnormalities which cannot be treated by orthodontic treatment alone. It involves certain procedures which are beyond the scope of orthodontic treatment alone. It is done in conjunction with an oral and maxillofacial surgeon. For example, for correction of maxillar mandibular prognathism, certain procedures like bilateral sagittal split osteotomy with mandibular setback, oblique subcondylar osteotomy, or sometimes reduction in genioplasty for correction of chin is required. Horizontal chin deficiency can be corrected in the form of genioplasty. Maxillary protrusion can be corrected with the help of a Lefort 1 osteotomy. Same can be used to correct maxillary retrusion. Bimaxillary protrusion, which is known as bimax, can be corrected with the help of maxillary and mandibular segmental osteotomy for setback of the anterior maxilla and mandible, and various other procedures. Here we need to understand that the oral surgeon and the orthodontist work together. Surgical orthodontics does not mean avoiding orthodontic procedures. There is pre-surgical orthodontics, there is the orthognathic surgery followed by post-surgical orthodontics. So this entire process comes under the heading of surgical orthodontics. If you like our lectures, do like, share and subscribe to our YouTube channel. For any doubts or queries, kindly mail us on our official email ID, let's simplify orthodontics@gmail.com. Your feedback is valuable. Thanks for watching.